Well, there's a remarkably wide variety of ways, none of them completely successful, unfortunately, but antibiotics that we currently use, vancomycin and metronidazole primarily, have reasonably high recurrence rates, probably in the 20 to 30% range. So one of the ways to improve that is to use antibiotics that are better targeted to C. diff, that do not disrupt all the other bacteria in the gut. So newer drugs like fidaxomicin, for example, are more effective at treating the disease and reducing recurrence. And then new drugs, as they're being developed, are trying to replicate that to try to be less causing of recurrent C. diff than the current drugs are. And we're making progress, but there's also been a number of failures along the road in those kinds of drugs. So in just the last couple of years, we've had 2 new antibiotics fail in phase 3 trials, unable to show non-inferiority to vancomycin, the kind of standard treatment. Now, other things that can be done, we can try to restore the microbiome so that it isn't any longer susceptible to C. diff infection. So that's being done by fecal microbiome transplants, and also by some derivatives of these microbiome preparations comprised of specific organisms that are obtained out of the microbiome and then are being re-administered to patients. And an alternative method is to try to improve the immunity of the patient, either through what's called monoclonal antibodies, which are infused intravenously, and they raise the level of antibodies to the toxins that are produced by the drug, and in doing that can reduce the risk of recurrence. Also, in that same line, vaccines are being developed, which ultimately would be primary prevention methods, and probably more effective as primary prevention than as prevention of recurrence, because these vaccines take weeks to months to develop an immune response once you've been vaccinated. They also require 3 doses right now, so they're kind of slow, but should be effective once they're on board. But we don't have any data as yet as to how effective vaccines will be. So those are the methods. There's one that I work on. That is a method that is simply a substitution of the toxigenic C. diff with a non-toxigenic C. diff that's the same species of bacteria but lacks all the genes for making toxins. And if that gets into your gut, it basically keeps out the toxigenic strains.